We are tracking the latest on the impact of the Omicron variant. Canada's top health officials say COVID case counts have increased by 65% over the last week. And the biggest concern remains the unvaccinated. In the latest federal briefing, Health Minister Jean-Yves Duclos said he can personally see that a broad vaccine mandate might need to be imposed at some point.
It's a view which is based on my personal understanding of what we see internationally and domestically, and in my conversations with my colleagues, health ministers, over the last few weeks. And second, it's a decision that will be made by provinces and territories at some point. Whether they move forward or not, that's going to be their decision to make.
So for more on all of this and other news coming from the briefing, we're joined by the CBC's Hannah Thibodeau in Ottawa. So Hannah, what specifically did Duclos say about a possible mandate? Because I think this is a new and interesting discussion. I mean, it's been had in the world, it's been had in other places. We know of some countries that have implemented it, but to have it being asked about, to have it being spoken about, I think, Hannah, at that serious level with the federal health minister as a possibility is something new.
Yeah, absolutely. It's the first time, Andrew, as you say, we've heard it from a federal minister here in Canada suggesting that mandatory vaccines could be a possibility. And in fact, since it's coming from the health minister, Jean-Yves Duclos, it adds that little bit more heft to it as well. He was much stronger in French when talking about it than he was in English. In French, he said that, they might need to have this discussion to make vaccines mandatory in Canada, because what he says is for the public health measures like masks, like rapid tests, they're all helpful. But the only way to get out of this COVID-19 mess is vaccinations. So take a listen to what he had in English, and then I'll follow up on that.
What will make us move through this crisis and end it is vaccination. And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people difficult to understand. So that's why I'm signaling this as a conversation which I believe provinces and territories, in support with the federal government, will want to have over the next weeks and months.
So you hear there in the French, he said that it was his personal opinion that mandatory vaccinations have to be considered. And then in English, as you heard off the top, he talks about this will be a decision that will be made by the provinces, because remember, this comes under provincial authority. So if the federal government were to take this over and to decide that vaccines had to be mandatory, there would be two ways it would have to be done. The first one, they could enact the Emergency Measures Act. That's the first way. The second way would have to be passing legislation to give it the authority to do so, because of course, this is the jurisdiction of the provinces. So they are going to have discussions with provinces. It's likely this will be something that will come up. We know that in Quebec, they're moving towards that, because if you want to go to liquor stores, to pot shops, to other different locations, they're saying you have to be vaccinated. So they're moving in that way, but a lot of provinces are. So it would be a really tough discussion to have, because every province is different, Andrew.
Yeah, some countries are making it mandatory, some countries are imposing fines. I mean, there's lots of ways, because it's about the hospitals, right? And that is where a lot of the growing concerns are over the states of the hospitals in many parts of the country, because very important procedures are being postponed yet again because of the COVID-19 situation, often, frankly, with unvaccinated individuals sort of, just cramming up the system. So what are ministers saying about Ottawa's role in addressing that?
Yeah, so here's the other thing that came out of this that was really interesting, Andrew, is the federal government is now warning Canadians and the provinces that the resources aren't finite. So they do not have limitless resources. And what Jean-Yves Duclos is saying, the health minister, is that they've seen this surge and this surprising uptick and pressure on resources, in particular in Quebec and in Ontario over the past couple of weeks. They expect to get a lot more requests, not only from those provinces, but from other provinces in the near future. They say that they may have to say no to some things because take this for an example. In Quebec right now, there are 200 Canadian Armed Forces that are helping get people boosted there. What they're saying are those types of resources, those type of health resources could be limited if all these provinces continue to ask for that. And they are having a meeting with the provinces early next week. So here's what Intergovernmental Affairs Minister Dominic LeBlanc had to say about that.
We're moving expeditiously to do obviously everything we can. But it's no surprise that provincial and territorial governments have considerably more health human resources, for example, than would the government of Canada. And that's why we need to be expeditious and effective in allocating all the federal resources we can in a way that most efficiently fills the gaps that provinces and territories identify.
So to summarize that, not a limitless amount of health support from the federal government, and also warning the provinces, both he and the health minister, to be efficient with those resources as well. Now, also, when it comes to rapid tests, we were talking about this yesterday, Andrew, and again today, the federal government was talking about this. So 140 million rapid tests will be coming into the country. They broke them down a little bit for some of the bigger provinces. In Ontario, Ontario will get 54 million rapid tests. Quebec will get 31.5, Alberta 16.2, and it's a per capita basis. But one of the other things they did mention is that the provinces are still asking for more. Here's the issue. What Jean-Yves Duclos is saying is that it's a global demand for this right now. They want to have these type of rapid tests. So again, they're having problems with the demand on supply. So they're going to have to be efficient with those types of resources as well. So a couple of big things coming out of the press conference today, watching for potential mandatory vaccine down the road, and also supply issues and what the federal government can provide for the provinces. So we'll hear a lot more on that in the coming days.
Hannah, thank you. That is the CBC's Hannah Thibodeau live in Ottawa.